Department of Health officials held a telephone briefing out of Tampa to announce changes in the statewide system of treating TB and protecting the communities where TB is diagnosed. TB is a highly infectious disease that can be deadly if left untreated. Here's what you need to know. The Centers for Disease Control recently released a report saying a cluster of cases among the homeless in Jacksonville and Duval County was one of the most extensive TB outbreaks that they've been invited to assist with since the early 1990s. Health officials responded by saying they have had 284 cases in the state so far this year, 43 in Duval County, 16 of a particular strain among the homeless that they're watching. But overall, they say, the number of cases statewide is going down. They also pointed out that this change in statewide policy had nothing to do with the cluster of cases in Jacksonville, but was partly in response to the closing of the state and the country's last TB sanitarium. Then health officials unveiled some changes in the new statewide system.
What the system does is it formalizes relationships within the counties so that the patients can be better served locally. In the past, we might have had to send people sooner to the hospital.
When TB is diagnosed, the first step is to make sure it's treated with medication and the sick person is isolated. Most patients can be treated at home. But in the case of the homeless, the health department is tasked with finding a safe place to isolate and treat to prevent the spread. In the Jacksonville area, they were using some cheap motels.
Department of Health will not be using motels for transitional facilities for patients with active TB who do not have a home.
For us, they could be boarding homes, they could be apartment efficiencies that are individualized.
Health personnel will go to the location and they will do a variety of things. One is obviously make sure that the medications are being taken right dose, right time. The second is making sure that other services are being provided so that the patient is not leaving that facility. And so that does involve providing food. It also involves dealing with laundry.
The health department says it tests for TB across the state all the time, but they're also testing to see if the strain in Jacksonville is spreading.
We have not identified any spread based on strain at this time across the state.
And presently in Hillsborough County, Dr. Holt says they're managing around 40 active cases. That's similar to statewide numbers, he says, but less than last year.